Is Melanoma Awareness Month, and skin cancer is the most common form of cancer in the U.S., but melanoma is the deadliest form of skin cancer. Fortunately, this is preventable, especially if you're taking the proper precautions. Joining us now is Dr. Annelise Dawson, a dermatologist at the Sweedish Medical Center. Thank you so much for coming in, especially we're talking about it hitting the 80s, everybody's out and about. Can you talk about the difference between things like being diagnosed with melanoma versus other skin cancers?
Yes, so there are three main types of skin cancer. By far, the most common types of skin cancer are called the non-melanoma skin cancers. Those are things like basal cell carcinoma and squamous cell carcinoma, and that is in comparison to melanoma. They tend not to be pigmented. They're usually more pink in color, which is the stark contrast to melanoma as far as the clinical appearance.
I'm just thinking about, folks who are saying, oh, I just noticed this new spot, or I didn't see that before. How often are you supposed to be going in to check? At what point should you be like, I really need a doctor to look at this?
Yeah, so we typically recommend an annual screening exam because oftentimes we spot things that patients aren't even aware of. But if a patient has a spot that they're especially concerned about, I usually tell my patients that if it persists for more than a month or two and isn't healing, then it's worth having it looked at.
And then what about treatments itself?
Yes, yeah, so the treatments vary widely depending on this type of skin cancer. For things like basal cell carcinoma and squamous cell carcinoma, the treatments can often be very localized and targeted. For things like melanoma, the treatment really depends on the stage of the melanoma at the time of diagnosis. If you catch it in a very early stage, then similarly the treatments are localized. In some cases, unfortunately, when it's spread, then we have to look at systemic therapies.
And I can imagine that the sooner you catch it, the better prognosis. Does the same go for melanoma as well?
Absolutely. So the non-melanoma skin cancers like basal cell carcinoma and squamous cell carcinoma carry a very, very excellent prognosis, and they grow very slowly. Melanoma, for sure, the prognosis changes a lot with the staging. So for very early stage tumors, they have a very, very high cure rate. Unfortunately, when melanoma is more advanced, then it can have a more poor prognosis.
Let's talk about prevention. I'm just thinking about all of the folks who are going out for like a barbecue or to the pool, or, like it's finally warming up. What do you advise to people? The right kind of sunscreen? What should they be looking at? Ingredients, SPF, all of that good stuff.
So in a place like Colorado where we have so much sun exposure and the weather can vary so much, within a short period of time, I recommend that patients wear sunscreen every single day, even if they're not going to be outside for long periods of time. It's important to pick a sunscreen that's SPF 30 or higher. And I favor sunscreens that have at least one mineral ingredient. When you're looking at the back of a sunscreen bottle, there's a section called the active ingredients, and that really highlights the things that give the sunscreen its SPF. So looking for something that has zinc oxide or titanium dioxide in it. But I think we also sometimes overemphasize sunscreen and underemphasize the things that are even more important, like shading your skin from the sun, hats, long sleeve clothing, seeking out shady environments, that sort of thing.
And for kids, is the same SPF, is that the same rule or is it different for them?
Typically for kids, the SPF is the same, though if you can find something that's closer to 50, that's even better. Okay, well this is such sound advice, especially as we're heading into the long weekend and everybody's gonna be out and about, so we really appreciate you stopping by. Thank you very much.
All right, thank you.